Fellow Barbadians, last Monday when I spoke to you of the pending stand-home weekend, many of you thought that was a difficult or even insurmountable hill to climb. But as a nation, we took a deep breath and agreed to take this uphill trek together. This evening, just about 12 hours before the scheduled end of the lockdown period, I am pleased to report that the last 2 days were very useful in helping to contain the spread of COVID-19 virus in Barbados. By coming off the road and staying in your homes, many Barbadians were able to take a break and enjoy family time. From the perspective of the Ministry of Health and Wellness, this period gave our healthcare professionals a better environment in which to operate and to help you. Our contact tracing exercises and Seek and Save initiative are always more effective and benefit from the presence of occupants at their homes and in a more relaxed and accommodating frame of mind. In addition, in the last 48 hours, many of our seniors and other vulnerable residents received their COVID-19 vaccinations in calm and organized circumstances and surroundings, including at a highly efficient drive-through vaccination center. In many respects, the national stop worked. The challenge we face tomorrow, however, is that we cannot account for the behaviors of persons once given the green light to leave the boundaries of their homes. Instead of keeping still and remembering to restrict activity and movement, people cannot wait to be on the streets again. I do not know how differently to say to persons that they do not need to run to the supermarkets and village stores every day to pick up 2 items. I do not know in what language I can speak to get youngsters lining on the blocks without masks and then going back home to their families and vulnerable seniors to understand that this is no longer cool. As Minister of Health and Wellness, I am running out of ways to say to persons that they must look out for and attend to the needs of the elderly. I am also concerned that despite numerous messages about what to do and the availability of hotlines open and manned by professionals to respond to questions and queries and give guidance, persons are remaining in their homes while experiencing all the symptoms of coronavirus infection. Let me remind you, the symptoms of which you need to be careful are similar to a cold, runny nose, headache, loss of taste or smell, fever, what Bajans call bad feels, sore throat, sinus drips. If you have any combination of these symptoms, do not try treating yourself. Do not remain at home. Get medical help. My dear people, I speak to you this evening at the point of begging. Our numbers are not improving as I would have liked. If health was the only consideration in this equation, I would recommend an extension of the national lockdown for a significantly longer period. But I want to believe that it is still possible to reach you, my fellow Barbadians, and get you to act in your own interests and in the interests of us all. I want to believe that I will not see unnecessarily long lines at supermarkets again tomorrow. Supermarkets are going to open Monday, Tuesday, Wednesday, Thursday, and Friday. You do not need to go top up on the steaks, fish, or the 3 tins of corned beef you have in your cupboard. You are not going to use these items this coming week, all of them, because you did not use them last time or last week. I implore you, stop the topping up. There is and will be no food shortage in Barbados. What most of you have in your homes right now can last a few more days until we are out of the pause. I also understand that some people work week to week or day to day and cannot buy large stocks of goods. This is part of the reason why the government distributed so many care packages, so that you would not have to leave home, so that you would not have to keep dropping in to the supermarket. We are going to end the mandatory stay-at-home order at 6 a.m. tomorrow, but that should not be the passport for you to hit the road, as if COVID-19 is not out there. Perhaps I should share with you the figures for yesterday alone so that you get an idea of how dangerous and indeed how reckless and irresponsible it is for you to be heading out every day with no urgent business to conduct. On Saturday, February 20th, a total of 756 tests were evaluated by the Best Dos Santos laboratory. From those 756 tests, 57 were returned as positive, 28 males and 29 females. 53 of the 57 carry Barbados ID cards. So after a clear 2 weeks into the period of pause, we still have 57 persons out of 756 tests being determined positive in a single day. That is too high a number. It is too high a positivity rate. It is telling me that we still have a long way to go before we can declare ourselves on top of the COVID crisis in Barbados. I know and understand very well that we cannot keep the population on lockdown forever. I understand that you have to go about your legitimate business. I understand that commerce must recommence. I understand that we need to keep the economy turning, even if not churning. But I would like to appeal to you to make each departure from your home a necessary departure, and a departure that is with focus and purpose. Let us remember these increased numbers that we are seeing today are as a result of persons being infected just about a week ago. We now have control over what we do today and what we do tomorrow. If we faithfully follow the protocols and minimize our movement, in other words, stay home, that is what will lead to an improvement in our numbers and our success in battling this awful virus. We will see those improvements in a week or two. So do not go to the supermarket on Monday and then on Tuesday to the pharmacy and Wednesday to pay a bill. Do it all in one day and stay away from the public the other days. Similarly, if you go to the beach or the park, it is for exercise and vitamin D, not long conversations. There will be a time for that in the future, but not now. I know that you have been inconvenienced in various ways by the human and other challenges experienced by the departments of the Ministry of Health and Wellness, such as delays in test results. I gave you figures a few minutes ago for testing done on Saturday. On Saturday, we released the results of testing done on Friday, and on Friday, we spoke to the outcome of testing for Thursday. What this suggests is that we have been able to attain and remain current in our testing. This was a particularly stressful period for us, due to no fault of the ministry or its officials. The reality is that supplies ordered since September of last year were slow in coming, and even those that we are relying on have been further delayed out of FedEx's headquarters in Memphis because of the snowstorms. The fourth date we have now been given for delivery to our consulate in Miami is this Tuesday, 23rd February. So let us all hope and pray that these supplies and others already ordered and paid for will arrive in a timely manner so that we can remain current with our testing and the furnishing of results within the preferred 24-hour time slot. During the past few days as well, I am aware of the inconvenience many have experienced with respect to transporting persons tested positive to the designated isolation centers. The numbers we have been dealing with in recent days and weeks are unprecedented, not overwhelming, but much higher than what we were dealing with before, and the transport of COVID-positive persons requires special, sterile vehicles and protocols if the transport teams are to be kept safe. We are continuously working to reduce the wait time and have augmented the transportation system. There will be more buses pressed into action so that we can improve on the times that people are waiting before collection. I also want to reiterate that after conversations with the Prime Minister this weekend, we have agreed that the government of Barbados is prepared to put persons whose living conditions may be overcrowded into a quarantine hotel while they are waiting for for their results. My ministry will therefore work on a program tomorrow morning to put in place arrangements for those persons whose home accommodation does not allow easily for separation and quarantining. We are not going to leave those of you at the mercy of your circumstances by leaving those who may be awaiting test results or transport in crowded homes where the virus can spread to others. The government is adamant that where we need to step in to ensure that you can be kept safe and those around you can equally be kept safe, we are prepared to do that. But equally, you must stay still if you are waiting on test results. No lining in or out of the house. No going on public transport and no reporting to work. You simply must not put others at risk when you know that you yourself may test positive within hours or days. So having said that, I wish to apologize not only to persons tested positive and waiting, but equally to your family and households who have had to endure the inconvenience of sharing facilities with known COVID-infected persons. But we hope this will now change. We are working on rationalizing transportation, and I am confident that drastic improvements will be made in the hours and days ahead. Fellow citizens, the battle against COVID rages on. Our health practitioners are working over and beyond that which could have been imagined 6 months ago. I want to take this opportunity to publicly applaud and salute those medical practitioners and other trained personnel in private practice who have stepped forward and volunteered their services to assist in every aspect and at every stage of this journey, along with those in the public service. Whether it was with manning the hotlines or assisting with the management and delivery of patient care at the quarantine and isolation centers, volunteer caregivers have been there to lend their knowledge and experience. And for this, we are eternally grateful. As such, I wish to single out the Barbados Association of Medical Practitioners in particular for their constructive and consistent guidance and assistance in helping us to manage this current wave. And on the point of managing, I believe I'm authorized to indicate to you that Barbados is motoring ahead with its national COVID-19 vaccination program. As of midday today, a total of 16,111 vaccines have been administered, and I expect this to surpass the 20,000 mark before the week's end. Again, I need your cooperation in this matter. Barbados is striving hard, and when I say hard, I mean very hard. The Honorable Prime Minister is personally leading the charge to secure vaccinations for every resident of Barbados, and also to have extras for those who visit long-term and may not have been inoculated. While I appreciate that there's a new and aggressive interest in and desire to become vaccinated, I would like to appeal to you not to rush the centers. The vaccination program is being rolled out in a very structured and deliberate manner. To date, we have focused on frontline and essential workers and the most vulnerable in our population. There's no need for you to show up at centers without appointments and wait in the sun for hours. We are currently contacting many of you who would have called the hotlines and signed up for the vaccine. Those of you with appointments will be given priority at the vaccination centers. So if you do not have an appointment, but you still want to pop by a center and try a thing, I caution you to know and understand that during this week, those with appointments, as well as the elderly and those with known vulnerabilities, will be attended to first. Presently, we have 40,000 plus vaccines to administer from this first shipment, and I'm supremely confident that before we exhaust this current supply, the Prime Minister will cause another shipment to arrive on island, thereby catering to an even larger number of residents. Rest assured that there will be no shortage of vaccines in Barbados, but please, let us be orderly and allow the most exposed and the most vulnerable to be vaccinated first. So, ladies and gentlemen, it's Sunday evening, and I do not wish to take up too much of your time. At 6 a.m. tomorrow, the mandatory stay-at-home order ends, but the curfew continues until February 28th. Once again, I implore you not to leave home if you do not absolutely have to. You are not supposed to go to work physically if you do not have to. You are not supposed to be in the supermarkets and mini-marts more than you absolutely need to. We have it in us to influence the test results that the country gets next week and the week after. We just need to follow the protocols and really, really stay at home. COVID numbers in Barbados are still very high, and each of us must play our part in bringing the positivity rate down. Right now, we are trending more than double what we would like, ideally. Therefore, we return to curfew status, and consistent with Directive 4, only absolutely essential services will be open from tomorrow and for the remainder of this week. I shall end now by repeating for you general information about the very latest COVID-19 testing and vaccination information as of midday today, Sunday, 21st February 2021. On Saturday, 20th of February, a total of 756 tests were evaluated by the Best dos Santos laboratory. From those 756 tests, 57 were returned as positive, 28 males and 29 females. 53 of the 57 carry Barbados ID cards. I end also with a personal altar call for national cooperation, national unity. Let us all be responsible in dealing with this matter. There is nothing that we cannot achieve together. This, ladies and gentlemen, is Team Barbados. And as I always say, the battle is won or the battle is lost by the spirit of the team. Good evening and God bless.